Once again, good morning, everybody. I'm Frankie Wallace, and I am working currently at NHS Supply Chain. So I've been here for just over a year. I'm working in a role around data standards, and I suppose kind of what I want to focus on today is, I suppose the piece about how data standards are very much the foundation for what we're trying to do around inventory management, around Scan4Safety, around all those things to improve supply chain efficiencies, to improve patient safety, to improve a number of the things that our colleagues have talked about this morning. And more specifically, I'm going to kind of try and hone in on this theme around a strategic data capture point and how inventory management systems kind of can be that thing and support that. Going on, so I obviously Anna has talked a little bit about sort of the background, if you like, and the history. So I suppose I wanted to kind of show it in similar ways, but I suppose something sort of building on what Anna has said, kind of that sort of landscape around what we're operating in today, and the fact that it's been a long journey. Obviously, there's a number of us involved today that's been around and talking about this subject for quite a long time. And it really started as you know, as Anna said, in the Department of Health when we sort of launched the e-procurement strategy back in 2014. So that was really kind of the starting point from I suppose a practical implementation perspective. And what we were really trying to kind of show through Scan4Safety is that sort of digitization and how it can kind of really support. And that's the thing about data standards. Without putting data standards in place, then you can't start to collect that data electronically. And that is really the foundation of everything that we're trying to do. So at that time, we had the NHS procurement strategy from an NHS supply chain perspective, really starting to develop their kind of inventory management system as it was. So EDC, that basic kind of data capture system, then developed EDC Gold. And so that was all kind of around that kind of same time, that development and rollout of EDC Gold. I suppose kind of following on from that, there was obviously COVID, whereby then we had the sort of the need to have better visibility of inventory management to really kind of support that resilience piece around the NHS system. And I think going on from there, then we obviously had the sort of the NHS supply chain had its own kind of view and strategy. And as part of that strategy for kind of supporting the NHS, we got to the point where in NHS supply chain, we created a business case for funding to really start to support the NHS in their rollout of inventory management, and that sort of critical enabler of Scan4Safety and that sort of first use case, I suppose. So we were successful in getting funding for 20 trusts, and we're working now with 20 trusts, and I'll say a little bit more about that later in the presentation. We have 3 partners from an inventory management perspective that we're working in, and we've built that we're working with, and we've built quite a big team now within NHS Supply Chain that can go out and support trusts and kind of work with them on the ground in this sort of deployment of inventory management systems. Excuse me. And so then the kind of other things on the slide further along are again some of those programs that Anna's been talking about, where we can really start to see how this simple scan and this kind of collection of data at the point of care really starts to facilitate other things going forwards. And that's kind of, I suppose, what we're really keen to be able to do and to be able to demonstrate. So moving on. I'm sorry, I'm struggling to move these slides on. Okay, so within NHS Supply Chain, we have set up what we're calling an in-hospital services team. So this is the new business unit, which was kind of formed within the last year or so. And we have two key teams within that, within the business unit. Deployment, which is the team which is really responsible for going out and implementing the inventory management systems and is running the inventory management program. And then we have a centre of excellence team who are kind of supporting that with subject matter expertise, and really kind of supporting trust with those implementations from I suppose, as I say, from a subject matter perspective. I sit in that centre of excellence team along with a number of colleagues, and as I say, we're there to support the deployment team. And so the programme is really about trying to support NHS Supply Chain's vision. So in terms of, we have three key kind of tenets to that. So buy smart, supply right, and partner expertly. And so what we're trying to do is, from that, I suppose, that we really try and provide some practical help. So one of the things that I think I've learned over the years of working in this space is that to really make things a success and to deliver tangible benefits, there needs to be practical help and support, whether that's a system like inventory management, whether that's on the ground resource and physical kind of help with people. Those kind of things is really kind of what really kind of gets it up and running, gets it embedded, and really kind of supports the NHS. The other things that we're trying to do is ensure that we can get IMS across all settings. So that's not just the focus at the minute is within hospital, but actually in the future, kind of doing more of that in other clinical settings outside of hospitals. And then obviously very keen to drive resilience and reduce risk as we go forwards. And so in terms of looking at the outcomes we're looking to deliver, really from a trust perspective, again, very much about financial and workforce benefits. So really trying to make sure that we can deliver savings through better inventory management, better visibility, but then also that patient safety piece through improved visibility of medical devices. From an NHS England perspective, again, really trying to look at how we can generate data at a local level, which then enables us to kind of have an aggregated view. So looking at feeding data from the hospitals that we're working with into the FDP and Federated Data Platform, and then enabling that aggregated view across the system, which again supporting that resilience piece. And from an NHS supply chain perspective, we are trying to make sure that we can help our customers seamlessly or have a more seamless experience, a better kind of ordering and integrated service from trust on the ground, ordering product, and how that then gets to patients, and how we can support patients and clinicians through a more integrated and seamless process. So I'm going to come back to that slide. So that, just following on from what I was saying before, so this is really about how we can kind of look at the data standards and how they support patient safety. So from a what we see Scan4Safety enabling is that patient safety, clinical productivity, and supply chain efficiency. And so what I've tried to kind of demonstrate on the right hand side of the screen is going back to, again, that piece around data standards and those being the foundations. So really looking at what are the identifiers that we need to support the different areas that we're interested in. So if you look at clinical productivity, we want to be able to look at the identification of what the procedure is. So we need an ID for that. We need identifiers for staff to be able to understand kind of what they're doing, how long it takes them to do something, how many members of staff there are in a particular procedure. And then there's other areas around there. So traceability, never events, very closely linked, excuse me, to be able to support that elimination of never events and to improve traceability of medical devices, we need those other identifiers. So we need product, we need patient, we need assets. So again, the GS1 standards support all of those things and enable us to kind of to really kind of focus on how we drive that data electronically. Inventory management, so what do we need for that? Well, we need a product and we need a location. And then those different identifiers then support on the right-hand side those different outcomes, if you like, in terms of patient recall and then product recall in terms of a product and excuse me, a location. On the far right, we're looking at how then we can understand better levels of detail around costs. So what's the true cost of a patient procedure? When we can capture all that data electronically that's required, so from a device down to all the different consumables and different products that you use within a procedure, they all can then be consolidated into that patient level costing. As similarly around consultant level costing as well. So in terms of the different clinical people and different staff involved in a procedure. So back to the left of the screen, what we're really looking to capture are those kind of four main areas. So the four in Scan4Safety is about people, product, place, and process. Although I think as we go along, there's very much an emphasis on improving processes, but also that process you can also kind of read as procedure as well, and wanting to be able to capture that data going forwards. So this slide, I did debate taking this slide out because, again, it kind of is a little bit duplicative of the one before. But the reason I kept this slide in is partly because when we've talked to trusts recently on our pilot program, I know this is a slide that kind of resonates within an NHS trust, and I think trusts find it useful to be able to share this sort of data with other colleagues when they're kind of trying to make the case for why do we want to do Scan4Safety, why do we want to do point of care scanning, because actually the benefits are to the patient. And I suppose I've touched on improved safety already. I suppose the other areas that maybe not talked about so much yet are the outcomes. So being able to capture data about the medical device that's used on a patient and associate that with the patient record means that you can start to look at, well, which devices worked the best with different groups of patients. So starting to kind of support that outcome data, and again feeding into the medical devices outcome registry. And I suppose the other piece around that is also that sort of positive experience from a patient perspective. So that concept of not having to cancel a procedure simply because we don't have the right size product, or we don't have the right product in stock, or it's kind of disappeared and we can't find it on the shelf. So those things about being able to have a better patient experience, that we can just make sure that things don't get kind of damaged, and we don't lose that patient and that positivity. So those were kind of some of those kind of key things around how we can improve patient safety through, again, just through that simple process of scanning. Going on to sort of the recent work that I've been doing in NHS Supply Chain, and again very much focusing on data standards. We've recently published a policy with suppliers in mind from a product coding perspective. There is a link here to the policy on the website. We do have a policy. We also have a guidance document, and it's the key things that you would expect. So essentially, we want suppliers of all classes of medical devices and clinical products as well to be able to adopt globally recognised standards, and GS1 is our preferred standard. So the global trade item number for product identification. There will be more and more drive to ensure that when a product goes onto our catalogue in NHS Supply Chain, that has a GTIN associated with it, and we will be getting to the point where products won't get onto the catalogue, especially if they're a medical device or a clinical medical product. They won't get onto the catalogue if they don't have a GTIN. And this is part of a wider programme within NHS Supply Chain as well, which is about critical data. So those of you that were on the recent NHS Supply Chain supplier webinar will have seen that we've got a kind of a broad range of, there's about 80 clinical critical data attributes, which are all required. So there will be more. We've got more information available about that if that's required. Going back to the detail on the slide, which is obviously focused on unique device identification. So again, making sure that those identifiers are on the product, so to enable scanning at the point of care. And for clinical consumable products as well, we also need to make sure there is a barcode on those products. So at the moment, that doesn't always appear, and that's really, again, once again, to kind of support inventory management processes, but also to be able to support association with the patient as well. So that goes back to that kind of patient level costing and understanding all the different products that have been used in a particular procedure. And you know, having visited trusts recently, it becomes clearer and clearer as to why that is required in a clinical environment, and to really be able to make sure that a product is scannable and is able to be associated with the patient. We've been looking from an NHS supply chain perspective about how we can improve data quality on the products that we supply, and I'm doing some work with GS1 and with Chris and George at the moment on how we can make sure that our customers can report to us sort of issues and challenges they have with data. As Chris mentioned earlier on, there's a web form that you can use to kind of send in issues about barcodes, and then looking at how we can improve that process. So from a supply chain perspective, we can talk to our suppliers about that. But it's really, or sometimes it is just knowing that there is an issue and the challenges that causes you. It becomes more and more powerful. And I know from an NHS supply chain perspective that's becoming more and more under the spotlight, if you like, as to how we kind of improve that going forward. So there will be more on that in the future in terms of how you can notify us of challenges and what we're going to do to kind of improve that going forwards. So going on to the next slide. So this is very much about that point that I was, I suppose, kind of trying to get to before, this idea of IMS and data standards supporting patient safety, and that really an IMS system can be very much a strategic data capture point. So I think sometimes we've been I don't know if accused or criticised is the right word, of not being sexy enough, not using the most exciting of technology. However, you know, barcodes work. You scan them; they're easy to use, providing they've been put in the right place on the packaging, obviously. But in theory, you know, it's a simple way of collecting that data. And then once we've captured it, we can use it in multiple ways. So the idea of what we can kind of deliver in terms of outcomes, we've got a number of things on there, which again, I've obviously talked about a lot of that already. So in terms of cash releasing savings from an inventory management perspective, and better stock holding, waste prevention. And then that patient experience and safety in terms of making sure that if a product has expired, or it's a left side and actually the procedure you're about to do is for a right side, then actually you can make that decision that says, oh, actually I can't put that I don't want to put that device in because it's actually the wrong side for the procedure that we're doing. And so again, things around that resilience and transparency, and making sure that we do have the right stock levels at the right time in the right place, and for hospitals, and making sure that if there is a challenge, we can kind of move stock around to make sure it gets to where it needs to be. And so this idea of that we can do one capture point, but then use it in multiple places. So this consumption of data. So it means that once we've captured that data electronically, we can then feed a number of different systems. So medical device outcome registry, the FDP, the Federated Data Platform. We're working with the team in NHS England on the FDP at the moment for a supply chain use case. So currently there are a number of existing use cases for FDP, but supply chain is a relatively new one for what kind of work going forward. So we're looking to kind of drive that and influence what that looks like and how that supports resilience and the NHS going forwards. I know we've got colleagues from the DHSE coming on to talk about PIM, but again, we're kind of working with the DHSE team on that, and how we can use our data to support PIM, but also how we can enhance our data from data that will be available through the MHRA systems and through the PIM in the future. So very much, and again, this has been mentioned already, just really trying to drive some collaboration around these all these different initiatives, trying to pull them together, trying to make sure that we're not duplicating, but also supporting and working with each other. Over the years, we've kind of been, there's been that sort of criticism that, people aren't talking to each other and there's duplicated effort and duplicated programs, or they're not joined up enough. So we're really trying to join up those dots, and certainly within NHS Supply Chain, one of my roles is around engagement and trying to make sure that the work that we do from a data perspective is absolutely joined up with other areas of work across the wider system, but also supporting NHS trusts. So the last couple of slides I've got is really just to talk about our inventory management program. And so I'm just going to, providing I can, I'm just going to nip back to that previous slide that I showed before briefly, which was about engagement. So just to kind of say, this is what we've been doing from an engagement perspective in terms of setting up our inventory management program. So there are a number of trusts who already have an inventory management system. So I suppose kind of out of scope, but we've been talking to a lot of trusts. We've gone through a sort of a selection process around submitting expression of interest. There is a questionnaire to start off with, then an on-site assessment in lots of places. So we have kind of narrowed it down. We've now got 20 trusts that we're talking to, but then that we're working with on the program, but then also supporting a number of other trusts in the future around sort of best practice, and making sure that once we obviously our intention is the 20 trusts is just the start of this initiative, and that actually we've got another 50 to 100 trusts that we want to work with in terms of implementing inventory management systems with as well. So once we start to kind of really go live and start to deliver benefit from the trust that we're working with, that will make the benefit and the return on investment case for another bid into NHS England, which we're talking to them about already, to ensure we get more funding in the future, to be able to roll out this more broadly across the NHS. So I'll just skip back to the last slide, which is really just to kind of give you the overview of the sort of the deployment status from the 20 trusts that we're working with. You'll see that some trusts are named, and some trusts are, or some blobs and circles are regions. The last two at the bottom on the far left, that should say the Northwest. One should say Northwest, one should say London. And you'll see that West Suffolk is out front, and West Suffolk is kind of I suppose one of our trailblazer trusts, in that they are going to be going live with their new inventory management system within the next few weeks. So kind of within the next few weeks. We've also got Sandwell and West Birmingham and Rotherham coming up very shortly as well. So in the next sort of month or so, we've got another 2 hospitals. So we should have the kind of over what we call, you'll notice, those of you that have been around a while, we tend to work in seasons. We don't tend to talk months. We tend to talk summer, autumn. Well, certainly in the civil service, it felt very much in the department. It was kind of seasonally based. So seasonally, we have a few go lives coming on in the summer, and then we have more coming sort of through the autumn and sort of towards Christmas and into the winter. So as I was going to say, we have 9. So there are 9 trusts named, and they're named because they have signed their operational partnership agreement with us. So that is the sort of the legal document between ourselves and the trust that we're working with, to just really make it to the formal process. So what we're trying to do is just make sure that we will release the rest of the names of the trusts, and once that paperwork has kind of been signed off. So just in terms of where we're up to, so with different trusts, you'll see they're at different stages, and clearly West Suffolk are in that UAT phase, and I think that's probably just about completed now. We're doing lots of engagements. There's a broad engagement program with each trust, which include obviously training on systems from a materials management and procurement perspective, but then we're also doing clinical workshops with the technical, with the IT teams, workshops with finance, and really kind of making sure that everybody understands the benefits kind of process, and so that we can really document what benefits we have achieved so that they can be then submitted back into NHS England. Some of the challenges, as you would expect, is really around resource and the ability to kind of recruit people into the teams. The way the programme is structured is that NHS Supply Chain put in funding for licence fees for the inventory management systems to kind of to start the process, and then the trust will take that over in later years of the contract, and we essentially expect the trust to have some resource as well. So there's like a mirror team that will work with the NHS Supply Chain, team as well, that we go in. So we'll have 2, 3, maybe 4 people that will go in and on site and work with the trust to kind of support that rollout. So the other sort of challenge is really around that sort of capacity in terms of getting a business case through. So because the trusts are putting in funding as well and putting in resource, they obviously need to have a business case signed off. That takes longer, possibly than certainly from an NHS Supply Chain perspective we were maybe expecting. So that's kind of added some I suppose delays to a degree into the programme, but it's just the reality of obviously of how things work in the trust. It's not necessarily as it takes time and effort to get those kind of things through. And the reason I've mentioned the data quality on this slide as well is just one of the things that we do kind of up front is take spend data from a trust just to understand, sort of to try and do that benefits forecasting, and some of that data isn't always as maybe quite as high quality as you might need it to be. So again, that just takes some time to kind of work through some of those data issues. So I think that was the last slide. Happy to take any questions or comments.